I want to thank everybody so much for being here. It means a tremendous amount that you all care to come out on a Monday night at 5:30. I'm sure you're like exhausted and just want to go home and sit on the couch and watch TV. That's what I would do, but usually not quite at 5:30. And while we're doing that, I think I am going to introduce you to the newest member of our staff. Mandy, can you come up here so everyone could see you? So this is Mandy Shreve. She is our Homeless Solutions Director and essentially started like Thursday. So, and she comes with lots of experience, and we're really, really lucky to have her. And plus, I think everyone's going to be better off having Mandy as the director instead of me trying to wear like 4 hats. She'll be much more responsive, be able to follow through on things, and so very grateful. Do you want to say just a few words, maybe?
I can. I've just loved being here for the past 3 days. Everyone's been so welcome and inviting, and looking forward to getting to know each of you. So I'll hang around if you want to introduce yourselves, and we can talk and figure out how to get a hold of me in the future.
And Mandy's daughter's an excellent swimmer. And what didn't she make some team already here in Colorado?
She'll qualify to swim for the state of Colorado in July.
Woohoo! Awesome.
Yeah.
Olympics is next.
Oh, I don't know about that.
When we think about our Homeless Solutions Department, the way I think about our strategy is really kind of 3-pronged, right? Providing education internally to the city. This is a brand new department for the city. Also to our community partners on a variety of evidence-based practices, and specifically the ones that the city has endorsed that we're going to use for our homeless service programs, like the Housing First model. And so a couple ways we're doing this is by having these community meetings. We're committed to do it every quarter. Our goal is to do it in different locations throughout the city. Also, we had Dr. Samson Barris. He comes every other month and last fall did a kind of community forum symposium about Housing First. The first part was a 101. Second half was more kind of case studies utilizing our initial service team. In terms of demonstrating, right, we want to demonstrate what fidelity looks like to these evidence-based practices. So we have 3 different service teams. The first one is foundations, and that is an intensive case management team that is working with people who have the greatest number of challenges, have been homeless the longest. I mean, the average, and their goal was to serve 60 people because they got 60 vouchers. Vouchers is how the housing is paid for, and those came from the state. And so we have a caseload of a 12 to 1, so each case manager has 12 clients that they're serving. And so people, I remember when I first started, my boss, city manager Lee, said, okay, when are you going to be able to start taking more people? And I said, not until I get more vouchers and more staff, because the population we're serving needs intensive services. We know for the most part that they will be with us forever. It doesn't mean we'll have to provide as intensive services, but they're probably not going to be able to get competitive employment enough so that they can pay rent, food, and all of that. And so our team is doing things like we have a gentleman that we see twice a day who is insulin-dependent diabetic. And so what we do is we go, he draws up his insulin, we're kind of making sure that he's doing the right dosage, and monitoring that very closely. We also have a local physician and nurse who's going in and checking on him as well. There's other people too that we're seeing every day because they need that level of support. We don't see anybody less than 1 time a week on this team. And I say that just so people kind of have an understanding that, one, there's different populations, obviously, within the total homeless population, and the city of Greeley decided to focus first on the people who most people refer to as kind of the chronic homeless, they're most visible, unsheltered typically. And so we have our 60 people, they're in housing, but the team, as they started, they met several people who maybe didn't quite need that level of support, and so they ended up ultimately helping 81 people get into housing. So, but the people they're continuing to follow in this intensive way is 60. The other teams, which you're going to hear about tonight, you'll hear about our outreach team. So that's the one that just started up, and they're going to be working 7 days a week, 10 hours a day. I'm not going to say anything more because Nyet is the manager for that team, and he has a presentation. And then the most recent team is the rapid rehousing team, and they're going to be able to serve an additional 80 people. Focused on people with perhaps more moderate needs. If they come across folks, though, that have that more intensive need, we're certainly going to find a way to support them and make sure that they get adequate service. So, in that, we'll have a lot more discussion about our next community meeting on that team. And then collaborate. Mayor's Task Force is just one example. So we started up our Mayor's Task Force on homelessness, and we're still kind of growing it and defining it. Really, that group is a place where we're bringing data to help people understand, because this is a group made up of folks from across all sectors in our community, from the business community to our social service providers. Some of our faith-based leaders are there as well. County members are there. We have Council Member DeBeauty is there. Thank you for being here as well. Obviously, our mayor, he shows up, which is very nice. And, and it's just a great group of folks. Not everyone agrees. Not everyone is totally aligned on what philosophies we should use, but it's important to have those critical discussions as well. So it's also a place to say, like, okay, our goal for this year is to reduce the number of people who are chronically homeless by 70, right? I feel very confident that we can do that, and hopefully we'll be able to far surpass that. But we're meeting every other month, and we have a dashboard of different data metrics that we're presenting. So it's also a way to kind of keep us all accountable, and if things aren't moving in the right direction, we can take a look at it together. So, but collaboration is also happening every single day. And my teams are new, and one of the things that they're charged with and have done a really good job with and working hard is to collaborate with all of the different stakeholders in our community who's been doing this work for a very long time and really working incredibly hard at that. And so we can learn from them what they're doing and also make sure that we're all, based on our resources, based on our target population, that we're making sure that we are not, I don't worry so much about duplication of services because there's been a lack of services, but make sure we're matching people with the right service, right? So if there's an agency who can really help someone get into housing, maybe navigate that first step, but isn't able to do that follow through, then certainly we don't want to be referring people who have kind of the greatest number of needs to that group, and vice versa. So, and that'll take some time, right? All of this takes some time, which I hate, but it does. It's just the reality. So, and the other thing, so this is strategy. What is the vision? And I don't know what's wrong with me. I get emotional when I talk about this stuff, so just bear with me, please. So what is the vision? I've worked in this field for 20 years, and it's incredibly meaningful. It has made my life richer to work with the people who we're providing service to work with other providers. But I've worked in places where the numbers were so large, like New York City and Philadelphia. One of the reasons I was very much interested in coming to Greeley was because this is the place that has a number that I think is still solvable, right, by taking action now. And so I want to be a part of that. To me, that's super incredibly exciting, feels meaningful, and something worth doing, and something worth doing 12 hours a day, 7 days a week, if that's what it takes. Because it doesn't feel like work when you have that sense that we can really do something that hasn't been done in other places. So that is the vision. But this is what we're dealing with, right? So, and it's taken several months of several providers working together, from the United Way to North Range Behavioral Health, our police department, to really look at how are people coming in to the system, and this is not complete, and who is working with them, and what is the pathway out into housing. Because we know that that is ultimately the goal, is housing and making sure people stick in housing, right? So that it's not this cycle, because there's nothing more demoralizing than that. Good news is prevention is small, but it's growing compared to last year. We have a couple of organizations that got larger grants, and so they're able to help some more folks. And really, that is the key, right? The more we do there, the better off we'll be. But right now, our total, 363 people, and that's after the 80-plus folks we've already talked about have been housed, and that's after. Like, we weren't the only ones housing people, right? Other organizations also doing that. So, and I know for people who have lived here for a long time, that feels like a really big number, and it does make an impact. It's an impact on the people experiencing homelessness. It's on the impact is we're walking by and maybe feel unsure, feel empathetic, but not really clear about what we can do. For the business owner who's like, people won't come into my business if I have somebody that's homeless in front of my business. All of those are important considerations that we need to be thinking about. So, and when we look at, in terms of our chronic number, and unfortunately I don't think the link is going to work for this, I think we said at our last task force meeting it was 147. So we want to reduce that 147 by 70 people. The thing is, we have this new outreach team that is like on steroids. So they keep finding more people. So it's possible the number's going to grow a bit until like we feel like we've perhaps touched everyone. So thank you. And this is a question that I get a lot. So I just wanted to put it out there. So our city budget is actually more than that, but 350 million plus. The housing department, which you're going to hear from Deb Calise, and we're also so incredibly lucky to have her as our housing director. I mean, I've already learned, she only started in February, I've learned so much from her. So I can't wait for y'all to hear what she's going to be doing. And so 7.3 million of that 350 is housing. And then in terms of the general fund portion, actually, I should figure out what 8% of 350 million is. I'm a social worker. Whoever's better at math can do that. But, and then 92% is grant funded. And the grants, it's not as if we know exactly what we're going to get every year. So it can go up, it can go down. It's a little bit of a moving target. And then in terms of our homeless solutions department, the total budget is 5.5 million, and we get 26% of that 5.5 from the general fund, and all the rest is grant funded. So just please, because I've heard some crazy things. I've heard people say that like our homeless solutions department is being funded $20 million all by the general fund. I wish, but not true. So go ahead and let others know as well. And yet, come on up. And yet, would you mind saying just a little bit about where you're from and why you came to Greeley? And we know that like everyone wants to come to Greeley, and thank you for coming.
Hi everyone, my name is Nhật Nguyen and I'm the outreach teams manager for the city of Greeley. Can you guys hear me okay now? I'm a little short, so it's kind of hard for me to But anyhow, I came from the city of Boulder. I was working for I was working for the Boulder Municipal Court. I ran the community court program that has very similar to what the outreach team do here in Greeley, where they help with anyone who's homeless that goes through the court system. Before that, I worked at the Boulder Shelter. I ran an outreach team there. I was a case manager for them. I was a coordinated entry worker. So I've been in this field for about 8 years, and I'm just very excited to be here and get to know everyone. So thank you for having me. But about the homeless solutions team, the homeless solution outreach team, we currently have 10 members on our team. With one opening, we do have that position posted and are hoping to fill that position as soon as possible. We do actually have a few of our members here today. If you guys want to stand up, Rachel, Lucas, and Jeremy walking at the back there. You guys will probably be seeing them a lot. They're awesome, and they're doing really hard work and great work out there. And Juliana have said before, we are doing street outreach 7 days a week, 365 days a year. We're out there from Monday through Friday from 7 a.m. to 8 p.m. And we're out there on weekends and holiday from 9 a.m. to 7 p.m. And then just a little bit about what we do. We will help any clients we work with help obtain their vital docs. That is the ID, social security card, birth certificate. Those are very essential to getting a housing voucher so they can stabilize their life again. We connect clients to resources, including housing resources. And we will help them apply for benefits like SNAP benefits, that's food stamp, Medicaid, SNAP, SSI, SSDI, and such. We will provide transportation to clients to various appointments, like to a medical appointment, to a mental health appointment, to housing appointments and such. And when it's appropriate, we will try to divert the client. That is, if we can confirm they have better housing options elsewhere. If they have family or friend that will take them in, we will try to help them and reunify them with their family. But of course, our ultimate goal is to try and get the client back into stable housing. And just a few statistics I would like to share with you all. We have 168 clients enrolled in our outreach program currently. And of the 168 clients, 50% of them have reported that they are from here in Greeley. And 34% of those clients reported living in Greeley for 1 year or more. And 16% of those folks reported living in Greeley for 1 year or less.
So about 85%.
About 85%.
Greeley for a year or longer.
Yes. And just some more statistic, we have done a total of 95 VI SPDAT assessment with our clients. And the VI SPDAT assessment, for those who don't know, is basically a vulnerabilities assessment. And it put our clients on a housing list. And we meet weekly with other service providers around the city of Greeley, around Weld County and Larimer County. And we, if there's any housing resources, we try to match the appropriate clients to that resource.
If they don't get matched, you don't get that done.
That's right. It's an essential step. That's one of the things I love to do with clients is getting that VI SPDAT done with clients, and my team has been absolutely awesome at doing that. And then the average length of homelessness for our clients at the moment is 21 months. And just to show you how vulnerable our clients are, HUD defines chronic homelessness as being homeless for 12 months or more, and our clients are at about 21 months. And in collaboration with our rapid rehousing programs and other service providers in Greeley, we have helped house 12 clients. And we do have a further 12 clients in our bridge housing program that is then hotels throughout Greeley. And we hope to get those 12 clients in hotel right now and any future clients in hotel to get funneled through and matched to our rapid rehousing program so that they can get back in the housing. And here is our number. I have left some cards, or Emma have left some cards out front. So if you guys haven't grabbed that yet, please do. It does have our outreach number on there. If you guys see anyone out there that could be vulnerable, struggling, maybe struggling with mental health or substance, but it's not a danger to themselves or others, please give us a call and we will try to respond to you all as soon as possible. But thank you all.
All right, so thanks everybody for coming. My name's Deb Calise, and I am the new housing director for the city of Greeley. It's a brand new department, just like our homeless solutions. And I do have to say that I have been impressed since day one on the work that the homeless solutions team has done. Even just the fact that it exists at the level that it does with the people and what they've done so far in like 5 minutes time is really impressive. I've worked in Northern Colorado now for 25 years, ever since graduating from UNC, and I've never seen anything like it. So this is really impressive. But switching gears to the Housing Solutions Department, go ahead. We do have, Ashley is here, and BJ is back there. The three of us are the team that's doing the work. Yes, thank you. And then under the leadership of Juliana and her vision for what we were going to do. So we're all here tonight, so thank you for that. We hope to grow the team as we grow our programs and get things out there in front of council to do more of the work. So homeownership assistance programs are something that we are already doing and that we hope to expand on. We will be doing a housing strategic plan. We're working on contracting with a firm right now to get that going. And so, but we do have what's called the G-HOPE program, which you may have seen flyers and grabbed one on your way in. And I'm going to go into that more and some of the statistics around that program. But so that's the existing program that we have, and that's an exciting. Oh, go back one more. I'm sorry. That's okay. We also, through our CDBG and home funds, which are federal dollars that we are an entitlement community for and have been for a very long time. And typically what we've done historically is do infrastructure projects. So things like was mentioned earlier when Winna was talking about sidewalks, right? Things like that. Those funds can be used for that. They can also be used for affordable housing projects. And so as we build out our plan, our strategic plan, and look at the funding we have, those types, there may be more of those projects coming in. We also do have one of our partners here tonight. Thank you, Jody, for being here, who just was able to close on the financial work around Star Rise, which is a permanent supportive housing development. Those are no small miracle to get it done. And so that project was able to get some CDBG and home dollars, and that's a really great project for those federal dollars.
And that's, let's just say like what that is and how many people that'll take.
Yeah, so it's 58 units, correct? Yep, 58 units of 30% AMI or less. And so if you want to know what that means, 30% of the area median income or less, folks have to be income eligible to be there. So that's going to be for sure your folks, like if you want to look at dollars and cents, that's, a full-time, if the person is working, full-time minimum wage is going to fit under 30% AMI. And we just don't have any other 30% AMI. That doesn't naturally occur anymore in the world. Also, our folks that are on Social Security or disability, if that is their income for their household, they're definitely going to be under that 30% AMI. This particular development, and Jody is obviously the expert, but will primarily be around permanent supportive. So that means there's also services available for them to be successful and stay there. And it's much more complicated than that. But it's a very hard thing to do because the cost to build that building and the cost to build another 58-unit apartment complex is the same amount of money. But this one is going to get a bunch of rent for it, and this one just really isn't. And so the way that you have to do it is you've got to find 850,000 funding sources to go in there, and anyway, it's a big thing, but it's no small miracle. So thank you for getting that done.
And we have such limited resources, options for people to exit the homelessness, out of homelessness into permanent housing. And so adding 57 units
That's huge.
is unbelievable.
Yeah, adding 58 units, just for the camera, yes, it's really amazing. Adding 58 units for permanent supportive it's like gold, liquid gold. Go ahead.
Can I ask a question?
Sure.
So the Loveland Permanent Supportive Housing Complex that was just built, they prioritize Loveland residents. Will the Greeley permanent supportive housing prioritize Greeley residents?
So that is a question for High Plains, but it looks like Jody is nodding. So yes, it sounds like there will be some prioritization there. Yeah, yeah, for sure, yeah. Okay, so
And what did CDBG provide in home funds in terms of dollar amount? It was about $1 million?
it was a little under that, I think, those two combined. And then the city also came in with 1.5 to help. And, 1.5 million would be a ton of money if it was in my bank account, but it is not actually this huge amount of money when you're building a 58-unit apartment complex. I mean, those can be, what, I want to say 37 million?
It's
27 million to build it, right? So it's not chump change, but it's really kind of unbelievable what it all takes to get there. Okay. So G-HOPE, so Greeley Housing, what does the acronym stand for, Ashley? I'm sorry. Homeownership, Greeley Homeownership Program, thank you, for employees. So this down payment assistance program is not an income eligible down payment assistance. So that means that anyone who wants to purchase a home in this geographical area, so this program is bound by geographics, and needs to be somebody who's working in Greeley. It doesn't have to be somebody who works for the city of Greeley or even any other particular employer, but someone who is working here. And the idea behind that, of course, is twofold. One is
I think the initial intent was to revitalize the downtown area. So anything, I believe it's 35th East, basically, okay? And then the other was to help folks and help employers that need employees to live in Greeley, right? And to be able to afford to live in Greeley. So the different zones correlate with the amount of a down payment assistance that you can get towards the purchase of your home. And it just needs to be in that geographical area and somebody that works in Greeley. So the zone 1, it can be up to 8,000, zone 2, 6,000, and so forth, okay? One of the things that we will be bringing forward at some point here quite soon this year will be some additional down payment assistance program information or opportunity that will be for low income. And these funds could actually be stacked on top of one another, right? So we could have a household that wants to purchase in this area that's low income that could take advantage of an additional down payment assistance on top of this, and they're not double dipping the funds so they can get more into home ownership. And we do know that home ownership, it builds prosperity. And it also increases your stability for your housing because your rent's not going up every 6 months or every year. So to be a homeowner has tons of benefits that we hope to help other citizens of Greeley take advantage of. So some of the statistics of what G-HOPE has done so far. And I didn't do any of this, but it has been done. It has been done by the city of Greeley. So since 2015, we've provided $227,000 towards down payment assistance. That equates to $18.3 million in real estate that has been purchased using this assistance. We estimate that the real estate appreciation of those homes could be around $8.7 million, so there's some equity there built for folks. And average appreciation per homeowner is $116,000. The thing to know too is as Greeley grows, supply and demand kicks in, as it would in any other community. The home prices will increase, which is great if you own a home in Greeley. That's a wonderful thing and definitely a goal towards our economic development efforts and all of those things. But it will also make our affordable housing crisis worse. So the Housing Solutions Department is always going to be kind of balancing this. How do we help Greeley grow strategically to increase our affordable housing options that we have, as well as the economic development of the community? And so that's always going to be kind of this sort of seesaw of efforts that we're going to be doing. Where is this? Oh, so area median income, again. And it took me quite a while to really, truly understand area median income and how it relates to housing. So There are no dumb questions. Please feel free to ask either now or after the presentation too, if you'd rather. But the folks who purchased homes in this program since 2015, that's 61 to 80% there in the middle, 27% of those would be also folks that could get down payment assistance program from other things, because that does fit within our low income category. That's typically what we look at in the industry of affordable housing. And then 32%, 80 to 120, which that would be sort of like your missing middle, if you've heard of that. If you've heard people talking about missing middle income housing, that's that. And then, of course, 121,000, 32% were in that. And also a little couple 2%ers. That's pretty impressive that some folks were able to purchase a home under 60% AMI, because you could qualify for a Habitat home at 60% AMI. That's the income limit for a Habitat home, okay? So what are we going to be doing? So we are currently working on getting us all set up and getting things moving. So developing that strategic plan. We do want to increase down payment assistance funds, because our home prices, if you look at us compared to Boulder County prices, it's literally $1 million difference. So you could take a house down there and a house up here, same specs, there's going to be $1 million, it's going to cost $1 million more just 45 minutes away from here. What's really great about that for Greeley and these down payment assistance programs is the down payment assistance helps to buy down that price so that they can afford the mortgage. So we have a limited window, but it's a window that if we get some down payment assistance out in the street, that will help. When I worked in Longmont, we had a down payment assistance program. A total of 0 people were able to take advantage of it, even though they applied and applied and applied, because the home prices were so high that even though we were giving them $40,000 to put out on the home, it still would not bring that price down low enough that they could afford the mortgage. So we've got a window. It won't be forever, but we are going to get that going. Revitalize owner. Yes, so we did apparently have a home single-family, owner-occupied rehab program at one point, because preserving housing is also very important, and people's income sources and income amounts change over the course of their life. So if they've lived in the house a long time, and now they're on Social Security or something like that, or they just have limited income, or they're living off retirement, but they need a new furnace or a new roof, those are big-ticket items that they may not have the cash for to do that. And so we're looking at revitalizing that program as well. That will help preserve housing for people who have been homeowners for a long time, and create equitable outcomes for folks in the community, right, as far as having opportunities to own homes.
So I think some people were able to get in on their phones. So how do I get to our next slide? There we go. Okay, what percentage of the people the city of Greeley is serving who are currently homeless in Greeley have lived here 5 years or more? And now we did include the foundations team as well in this. So is it 6%, 22%, 43%, or 62%? Ooh, I love it. The numbers are changing as we're doing this. All right. Oops. And where's our answer, Emma? Oh, people are still putting things in. All right. The answer is 62%. So we had 3 people say 62. Oh, 4. Oh, someone just put in their answer. Love it. Okay, so 62% of the people that the city of Greeley's programs are serving have lived here more than 5 years. And the reason we're saying that is because a lot of folks ask us that question because there is this, I think, myth, because it's a question that I've gotten in every single community I've ever worked in, which is if you build all these great programs, then people are just going to come to Greeley in droves. All of the homeless people will be coming here. Every place I've lived, that has not ever been the reality, and I think our stats here also show the exact same.
Of that 62%, how recently have they become homeless?
So of the 62%, oh, that's a very good question, Jim. I would have to, so we know that the people on Net's team that he's serving, right, a part of that 62%, have been homeless 21 months on average. And then the foundation's team, which would be the other part of this 62%, their average length of homeless was 6 years before we met them. So quite a while. Both meeting the definition for chronic homelessness. Okay. Next question. What is the most common instance you personally would call the outreach team for? And I'll read off the possibilities. Someone is in a mental health crisis, but is not a danger to themselves or others. So clearly you might see them, they're responding or seem to be perhaps confused, things like that, a bit disorganized, dealing with a bunch of stuff on the street, but not like threatening or screaming or yelling. You might see someone who's affected by drugs or alcohol. Again, not necessarily presenting any kind of danger or threat. So would you call the outreach team for that person? These are the questions. Seems to need help for their health or well-being. And then the last question is, would you call the outreach team if you saw someone who needs support because they're clearly homeless and they look pretty vulnerable? Perhaps they're a senior. I mean, literally, one of the first people I encountered when I moved here was someone who was a senior citizen, and she was in a wheelchair. She had a double amputee, not able to clean herself, and she was out at the King Soopers parking lot. Grave need, right? So, and our answer is, you could call for all of those people, right? So, but clearly I think what we want to make sure is that folks still feel comfortable. Like, you should call the police if you're feeling in danger, you think someone else is, right? So the outreach team can do a lot of great things, but they're not, if someone is presenting threatening behavior, scary, not safe, right? And that's a gray area. The outreach team is to disengage, and they would also call 911 as well. So please, I don't want anyone to think like you can't call 911, but our goal certainly is to have outreach for the people like we're just talking about be the first folks that are being called so that the police can focus on the things that they're uniquely qualified to do. Okay, next question. What is the maximum down payment assistance in the G-HOPE program? Choices: $8,000, $6,000, $2,500. Okay, everyone got this right. $8,000. Excellent. Thank you all so much for your time and your attention. We're very grateful that you're here.